before entering my patient's room, I check for any signs or precautions. My patient is in standard precaution. Knock, knock, may I come in?
Yeah.
Okay. I'm gonna close the curtain for privacy. Hi there, my name is Harpinder. I'll be your nurse today.
Hi.
What's your full name?
Vanessa Quinones.
Okay, can I look at your wristband and your date of birth?
9/12/91.
Okay, do you know where we are today?
The hospital.
Do you know what days of the week it is?
Friday.
Can you touch your nose? Okay, my patient is alerted and oriented ×3, follows commands, and speech is understandable. I'm gonna perform a hand hygiene, wash my hands. Okay, I'm here to do your head-to-toe assessment, which include a series of health questions, physical assessment, auscultating and palpating your body areas, and also I'll be checking your body for any wounds, lesions, dressing or IVs or any skin breakdown, okay? Do you have any questions before we start?
No.
If there's anything you feel uncomfortable with, you let me know, okay?
Okay.
So I'm going to start by taking your vital signs. So go ahead, sit up for me, please. I'm going to check your blood pressure. Okay, your blood pressure is 126/74. Normal blood pressure is 120/80. Okay, which is really good.
Okay.
Next, I'm going to check your pulse for full 30 seconds. Okay, your pulse is, I'm going to times that by 2. Your pulse is 64. Normal pulse is anywhere from 60 to 100. Next, I'm going to check your respiratory rate. So just breathe normally for me. Okay. Your respiratory rate is 14 and the normal respiratory rate is anywhere between 12 to 20. Okay, next I'm going to ask you if you have any pain from scale 0 to 10, 0 being no pain, 10 your worst pain. Are you having any pain?
No pain.
Okay, what's the number on the scale?
0.
0. Okay, my patient stays having no pain at this moment. Alright, next I'm going to start by inspecting your head, okay? I'm going to be checking any lesions, any bruises, any bumps or any infestations. My patient does not have any lesions, bumps, bruises, no infestations. Head is smooth and symmetrical. Next, I'm going to assess your face. Face is symmetrical, no bruises, no lesions, no drooping. Okay. Next, I'm going to check your mouth. Open your mouth and say ah, ah. Okay. Patient's alveolar bends back. Mouth is pink and moist, no cavities, no tonsil inflammation. Next, I'm going to check your eyes. My patient's sclera is moist and white. I'm going to check for conjunctiva. Can you look up for me? Conjunctiva is pink and moist. Okay. And next I'm going to check for perla, pupils, equal, round, reactive, light, and accommodation. Okay. So my patient's pupils are in the center of the iris. They are equal size. They are round, no abnormal shape. Now I'm going to check if they dilate, okay? So go ahead, look at the wall for me. My patient's pupils do dilate. Now I'm going to shine a light into your eyes and check if they constrict equally. Okay, my patient's pupils do constrict equally. Next, I'm going to perform a 6 cardinals of gaze. So follow my pen light without moving your head, just with your eyes. Okay. Good, very good. My patient's pupils are equal, round, reactive to surroundings, light and accommodate. No signs of nystagmus, strabismus, cataracts, or any vision loss. Okay. Hi. Next, I'm going to inspect your head for any wound, lesions, any bruises. My patient does not have any central lines present at this moment. Next, I'm going to check for your trachea midline. My patient's neck midline is symmetrical. No bumps. Can you look left, right, up and down? And my patient's neck has full range of motion. Now I'm going to check for any jugular vein distinction. My patient does not have any jugular vein distinction. Okay. Next, I'm going to assess your cranial nerves. Okay. First, I'm going to assess your cranial nerve 2, 3, 4, and 6, which is for vision. Okay.
Okay.
So go ahead, look at my pen light. Good. Next, I'm going to perform Snellen test. So cover your left eye and read the letter I point to.
E, P, O, E,
Next, other eye.
E, F, O, P.
Good. My patient can read at the far distance of 9 feet. Has no abnormalities in the vision. Okay. Next, I'm going to assess your trigeminal, your facial nerves. 5 and 7. So go ahead, smile for me. Frown. Wrinkle your forehead. Puff your cheeks. Stick out your tongue. Left to right. Good. Next, I'm going to do mouth, which is your cranial nerve 9, 10, 11, 9, 10, and 12. No, 11. Okay. So go ahead, swallow for me. Okay. Can you roll your tongue around? And I'm going to check for your gag reflex. Oh, okay. Next, I'm going to check your spinal cranial nerve number 11. So go ahead, push against my hand. Okay. Shrug your shoulders. Rest my finger. Good. My patient's cranial nerve 2, 3, 4, 6, 5, 7, 9, 10, 12, and 11 are working, functioning normally. No abnormalities found. Next, I'm going to assess for pronator drift. So go ahead, stand up for me. Okay. Feet together. Palms up. Close your eyes. I'm going to check this for 30 seconds. Good. My patient's elbows are straight, arms are symmetrical, and no signs of pronator drift. Okay, go ahead, have a seat. Okay. Next, I'm going to ask you, do you use any oxygen?
No.
Okay. Any shortness of breath, cough, sputum?
No.
Any chest pain?
No.
Okay. Next, I'm going to expose your anterior chest area. And my patient does not have any bruises, lesions, any scars. Okay. And next, I'm going to check your contour of your pericardium. Okay. Skin is normal for ethnicity. No cardiac scars. No bulges or edema present.
Okay.
Now I'm going to palpate over your wall sides. Pulmonary valve, aortic valve, earth point, tricuspid valve, mitral valve, which is also your point of maximal impulsive at the 5th intercostal space.
Okay.
Okay. No visible pulsations, no crepitus is present. Okay. Next, I'm going to listen to your heart, your cardiac landmarks. Okay.
Okay.
Aortic valve, pulmonary valve, Erb's point, tricuspid valve, mitral valve, and I'm also going to hear the mitral valve, which is the point of PMI, point of maximal impulse. I'm going to listen for 1 full minute. Okay, and I'm going to do the same thing with the bell side. Okay, aortic valve, pulmonary valve, Erb's point, tricuspid valve, and mitral valve. Okay, no murmurs or extra hard sounds are heard. Okay, next I'm going to listen to your lungs, okay?
Okay.
So you just take deep breaths.
Okay.
Okay, lung sounds normally, no crackles, wheezes, stridles, or ronchi. Okay, I'm gonna do the same thing when you put your ear side. I'm gonna expose, inspect, no lesions, booms. No lesions, booms, bumps. Okay, I'm gonna do the same thing. I'm gonna auscultate. Deep breath. Okay, no wheezes, striders, ronchi. I heard crackles heard. And next I'm going to palpate. Okay, say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, my patient's tactile firmitis is present. Vibrations are heard at the side and no cryptitis. Okay, go ahead, lay down for me. When was your last bowel movement?
This morning?
Any constipation?
No.
Nausea, vomiting?
No.
Abdominal pain?
No.
Okay, next I'm going to expose your abdominal area.
Okay.
Okay. My patient does not have any lesions, any bumps, any scars, any wounds, and no scaphoid or any protrudent areas. Okay. Next I'm going to listen to your bowel sounds, okay?
Okay.
Oh wow, okay. Right here really clearly. Okay. Bowel sounds are present or heard every 5 to 15 seconds. Next I'm going to palpate. So let me know if you feel any pain or discomfort, okay?
Okay. No pain, no pain.
Okay, no masses, no distinction or hard areas, any of the 4 quadrants. Next I'm going to check for rebound tenderness, okay? So let me know if you feel any pain. Any pain there?
No pain.
My patient does not have any rebound tenderness. Okay, next I'm going to assess your upper extremities, okay?
Okay.
Go ahead, sit up for me. I'm gonna check for circulation, sensation, and motion. Grasp my hand as hard as you can. Okay, wow, good job. I'm gonna check for temperature. Temperature is warm and dry. Color is normal for ethnicity. I'm gonna check for capillary refill. Okay, capillary refill is less than 2 to 3 seconds. Nail beds are firm, labeled, and healthy. I'm gonna check your pulses bilaterally. Okay, normal heart, normal rate and rhythms are heard. My patient does not have any PICC lines or any IV sites. Good. Go ahead and lay down for me. Next, I'm going to assess your urinary function, okay?
Okay.
My patient does not have any Foley catheter, but if she had one, I would inspect the bag and the catheter and reassess the catheter if it was necessary. Okay. When did you last urinate?
This morning?
Okay. Any difficulty?
No.
Any frequent urination?
No.
Okay, good. What was the color of your urine?
Yeah, yellow?
Any odor?
No.
Okay. Good. Next, I'm gonna palpate your bladder, okay?
Okay.
Any pain?
No.
Okay, no masses and distinction is present. Next, I'm going to inspect your perineal area. Is that okay with you?
I don't feel comfortable.
Okay, no problem. I'm gonna ask you some questions. Is that okay?
Yeah, that's fine.
Okay. Do you have any swelling, redness, discharge in your genital areas?
No.
Good. Okay. Any trauma injury?
No.
Are you concerned about STI or HIV?
No.
Okay. When was your last menstrual period?
Last month.
How often do you have it?
Every month.
Okay. And when was your last pap smear?
Last year.
Good. Okay. It's done every 3 years. Okay.
Okay.
All right. Next, I'm gonna check your lower extremities for circulation, motion, and mobility. So go ahead, sit up for me. You're doing very good. Okay.
Oh, thank you.
Yeah. So go ahead, push against my hand. Okay. Cool. Okay, strength is good. I'm gonna check for temperature. Temperature is warm. Color is normal for ethnicity. Okay, I'm gonna. Thank you. That helps. My patient does not have any peding edema. I'm gonna check for capillary refill. Capillary refills every 2 to 3 seconds. Nail beds are healthy, firm. Okay, and then no edema. And I'm going to check your posterior tibial pulse bilaterally, okay? Okay. And then your dorsalis pedis. Okay. The rate and the rhythm is normal. Okay, very good. So go ahead, lay down for me and turn on your side. I'm going to check your skin for any skin breakdown, lesions, wounds, or bony premises, okay? I'm going to check your bony premises. My patient does not have any skin breakdown. Heel is blanchable and no lesions, wounds, scars. I'm going to check your buttocks area. No lesion, no scars, no stitches. Okay, that's very good. Okay, go ahead, come back for me. Here's your call light. Okay. Put your bed in low position. So I really want to thank you for your time. Okay, I'm all done. Do you have any questions today? Okay. Okay, so I'm gonna go, okay?
Okay.
You have a good day, okay?
Thank you.
Okay, I'm gonna wash my hands, close the door,